The madness is a long road of crazy life. She always say to me, don't worry baby, it's just a passing cloud. When she's not here, I'm silent and sit with fear. Ooh babe, don't leave me. Love is an angel, is a light shines in your eyes. She always say to me, yeah, I love you baby, it's just an endless sky. It's just an endless sky. Whoa, whoa. When she's not here, I'm silent and sit with fear. Ooh, babe, don't leave me. Ginny sembra un angelo, nel freddo della sera, non vedo grandi cose, oltre la pioggia scura. Chi conosce Broadway, la vita che c'è sotto, dietro ogni viso teso, le storie d'ogni giorno. E per lei che il suo mondo, sì, con lei fino in fondo, e salirà su nel cielo, sempre con lei.
Hello everybody and welcome to another Sunday evening session with Happy Hour. I have prepared for you the new software version of Photo Finder Universe 2023, and it comes with the mole analyzer, the Photo Finder AI that we unboxed, which means you now see why the software is providing actually a confidence on malignancy. That means we added the so-called heat map in the software. That is an added value. It's an educational tool and quite exciting. So let us get you the ATVM, an efficient tool and quite exciting for your daily work. Thank you. Hello everybody, this is Moha. Welcome to Photo Finder.
Hello.
Hey.
Oh, I miss you so much.
No, we miss you so much.
I'm jealous that you are all together without me.
But you abandoned us. You abandoned us. You left us alone. Yeah.
Mama,
And now
Costas,
we are-
yours. Yeah, tell me.
You left us alone and we are doing crazy things without you.
Crazy things. Wow, you are in New Orleans, basically the country of rock and roll, of jazz, of blues.
Yes.
Come
Yes,
on.
but the bad thing is that we couldn't be doing crazy things with you. The problem is that we do things without you.
We wish you were here with us, Jeffy.
Yes,
Really, we
yes.
have great time.
Well, yeah, okay, but
By the way, a live update from the Congress. I don't know what's going on at this moment, but a couple of hours ago, something happened, like a fire, something like this, and the Congress was stopped. So I don't know at this moment if it's ongoing or not.
really, what happened?
Yes.
A fire within the
Oh.
Congress?
With the Congress Hall.
Ah, wow,
Yeah.
wow. So
Dermatology
everybody
fire.
I see. So where everybody had to leave the building.
Yes.
I see. Wow.
Yeah.
Yeah, that's the result when you are going to congresses without me, you know. Allora, ragazzi, we are together anyhow for the happy hour. What time is it in New Orleans, by the way?
1 o'clock.
1 o'clock. So did you have lunch already?
No, breakfast.
No.
Not yet. Very good. Very good. So you have no wine, no wine, no wine. Very good. Very good. So today we have a very nice, let's say, topic for the episode, which is, by the way, Sebbi, where are you? You know that this is a special day for me, by the way, because this is my name day. And
Name day.
my name day. And as you can imagine, San Giuseppe is a very famous saint everybody remembers about San Giuseppe, and therefore I was spending my day in greetings with many friends and so on.
But what can we say? What can we sing to you for your name day? What can we do?
Well, no, we don't have a song for the
There's
name
not a
day.
song, eh?
No.
Just many wishes. That's the only thing.
Yes.
That's our love.
We love you, JP. We love you.
Yes. I will drink all alone and thinking about you, my friends. But we didn't say hello to all the people joining us for the episode. We have more than 200 for the moment. And
from once again all over the world.
All over the world, definitely. What is the topic of the day? Maybe Sebbi can launch the question of the week. Is pregnancy influencing melanoma and or Nevi? That's the question. Pregnancy. What do you think?
Sometimes.
Sometimes. Yes,
there is a clear answer here.
Clear answer. Well, we will try to convince you that pregnancy is definitely influencing melanoma, especially melanoma prognosis, but not too much Nevi, correct? Do you agree, my friends?
Absolutely.
I agree.
More or less, yes.
Yeah.
Yes.
Okay. And
We always agree with you.
Sorry?
We always agree with you.
Yeah. Sorry. So I would like to I'm in charge for the paper of the week. Sebbi. No sound.
No sound again. No sound.
No sound. Sebbi. Sebbi, we are so sorry.
No problem.
Yeah, we didn't hear any sound, but we have a very nice paper to Yes.
Okay,
yes.
Now
we got the sound.
Now we are ready.
We got the sound. We got the sound. And to announce the paper of the week, which is a paper we published a few years ago already, 2017, with the basic, very important help of Athanasios Kirgidis.
That was a good effort. Come on, Emilius. It was a good effort.
Yeah.
Yeah. So Athanasios is a good friend of Emilio. He is a Greek guy, of course, a Greek colleague. By the way, he's not a dermatologist. He's a head and neck surgeon. Huh?
Exactly.
And so he is actually a head and neck surgeon, but is very skilled in statistical analysis and in work in the field. So he is basically sharing his life in between cutting faces and so on, and being a farmer. Can you imagine? Is it still like this?
In the meanwhile, doing also statistical analysis, meta-analysis,
Yeah. He's a crazy guy, completely crazy.
Emilius, he also works with Cochrane Group, right?
Yes. He's very good.
He's very good.
Top level biostatistician. Yeah.
Yes. And at that time, we had a question we wanted to answer, and the question is: does pregnancy influence melanoma prognosis? So, in order to answer this question, we performed, with the help of Thanasis, a meta-analysis. A meta-analysis is a kind of a very difficult, very complicated way to analyze the previous literature. Okay, so we put together all the previous literature of the, of course, concerning the topic under evaluation, and a new statistical analysis is performed in order to have the results of the meta-analysis. And I give you immediately the result, the bottom line. The bottom line is that yes, pregnancy is influencing indeed melanoma prognosis. So overall, pregnancy-associated melanoma was associated with a 17% higher mortality compared with melanoma diagnosed in female patients who were not pregnant. 17%. It's a lot. And in addition, pregnancy-associated melanoma was also associated with a 50% higher recurrence rate compared with melanoma not associated with pregnancy. Okay, so these are the results basically of this meta-analysis. We a little bit the details is here. We screened a lot of papers, but only 15 papers were included in the quantitative synthesis, so the meta-analysis. So only the most robust, most valid papers were included, and this is the plot analysis in which you can see that there is a difference in terms of survival. As I told you, 17% higher mortality for pregnancy-associated melanoma. And here you see that this kind of come si chiama square? It's not a square. Is a diamond. Is a diamond. This diamond, which is here, this diamond, which is here, is definitely more associated with the controls. So more is so the prognosis is most favorable in terms of disease-free survival in the context of non-pregnant women. So overall, this is the case. By the way, of course, our additional question was, but why not? Probably melanoma prognosis is poorer in pregnancy because the thickness of melanoma is higher. Because of course we can imagine that pregnant women do not go to dermatologists because they are completely concentrated on their pregnancy. So we have a kind of delayed diagnosis. But this is not the case. We were studying specifically the effect of thickness on the total outcome, and we realized that there is no effect. So because the effect that we were reporting previously was independent from thickness. So it's a true difference in terms of prognosis. So it looks like pregnancy is really influencing in a bad way the prognosis of melanoma. And here I just give you a couple of examples. This is a 27-year-old pregnant woman with this melanoma located on the leg. The thickness was 2.8 millimeter in Breslov, so it's an intermediate thickness, and she died a few years later after removing this bad melanoma. And this is another lady, one of my first melanomas I saw in a pregnant woman many years ago. She was a 37-year-old pregnant woman. The location was the frontal region here. It was a 2.5 millimeter breast of thickness melanoma, and she died 10 years later after removing the primary lesion. So she was okay for 10 years. And then after 10 years, she developed brain metastasis immediately. So with no lymph nodes involved previously, and she died quite soon. So that's what I wanted to mention concerning pregnancy and melanoma.
Of course, now the question that remains unanswered, and we can only hypothesize, is why?
Yeah, exactly. Of course, we don't know. Clearly, it's not thickness is not influencing this poorer prognosis. So delayed diagnosis
delayed diagnosis was a very reasonable guess, but it's not the case.
Not the case.
So then there are some theories that maybe the immunosuppression of the pregnancy plays a role, that the fact that there are, as we know, receptors of estrogens in the melanocytes might in some way interact with the growth of the tumor. Another point that I will show in a moment through a couple of cases is whether the management of melanoma during pregnancy is the one that it should be. So if there is any chance that to some extent this difference is explained by the fact that the management is not perfectly the same as we will see.
It could be. It could
Yeah.
be. It could be.
Yeah, but all these are hypotheses. There could be truth in all of them or in some of them.
Yeah.
But we cannot know for sure.
Let me tell you, this is also interesting because this is one of these cases in which we were initiating this paper, this study, believing the opposite. So at
Yes.
least in my case, I was sure that the result was at the end, no, there is no influence of pregnancy concerning melanoma prognosis. So we had even the opposite bias in some way, you know?
Exactly. There are already some questions, but before starting with the questions, let me show you also some things, because some of them will be discussed during the cases that I will show. So let's start first with something very, very simple. This is a case. This is a pregnant woman. This is a lesion on the arm. You can see how it looks clinically and how it looks dermatoscopically. Okay.
Yeah.
Now the question is, the first question and the most important question: do we think that this is suspicious and we should excise it now? Do we think that this is suspicious but we will excise it after delivery? Or we don't think that it's suspicious because Nevi changed during pregnancy, therefore we don't need to do anything? So it's a little bit a rhetoric somehow question. Hopefully.
Yeah.
Of course, the answer is which one? The answer is the first one. Suspicious, excise it now. There is no evidence at all suggesting that Nevi during pregnancy might become as ugly as this lesion here. So there is only some evidence that some Nevi might grow symmetrically, especially the ones that are located on the breast and on the abdomen, and this is purely mechanical. By the way, this was a melanoma 1.1, of course. So
and just to add to this topic something else, correct, we have to excise it, and we excise it now because we have to remember that during pregnancy we have to manage melanoma exactly in the same way as it is for non-pregnant women. Of course, we will not go through, I don't know, TC scans, for example.
It will come, Jeb, in a moment. It will come in a moment.
Okay.
What you're saying will come in a moment.
Okay.
So the only acceptable change in the pregnancy is, for example, here, you see that the woman became pregnant, and then her nevi, especially those located on the abdomen, might grow in this way. So you see that there is, yes, a growth, but this is a symmetric growth. The nevi don't substantially change, they just grow a little bit, and of course they don't acquire melanoma criteria. That should be crystal clear. Okay. So there are no substantial changes of nevi during pregnancy. One more example again of a lesion that is already clinically very suspicious and dermatoscopically even more. So there is no discussion here needed to be done. The lesion has to be excised as it should be excised also out of pregnancy. So we should forget the myth that nevi change. One more example, the same story, suspicious lesion. It doesn't matter at all if we are in pregnancy or out of pregnancy. Now, I would like for 2 minutes to show also some data concerning, we spoke about the prognosis, a few things about incidence of melanoma in pregnancy. There are some nice data, especially from Scandinavia. So look how interesting it is. In women of this age group, so 15 to 45, these are the most frequent cancers that we would expect to find. So breast, cervical cancer, and melanoma third. What happens in pregnancy is very interesting. So you see that melanoma becomes first. And this is really very strange.
Very peculiar. Yeah.
Very peculiar. which is the explanation? Again, one of these things that we said earlier. The point is, though, that if we look at the absolute numbers, this is not true. So look at the absolute numbers. These are the expected cancers based on the age group, women in this age group. And look now the observed cancers during pregnancy. It's true that melanoma became number one, but why? Not because melanoma increased. It became number one because breast cancer and cervical cancer decreased a lot. So that's why melanoma became number one. So in fact,
very interesting.
In fact, melanoma did not change. So the question is, does pregnancy protect from breast cancer or cervical cancer, or simply these cancers develop, but they are not diagnosed during pregnancy? That's an interesting question to answer. And we can answer it if we look the data post-pregnancy, because if it was just a matter of diagnosis, then post-pregnancy we should have an increase of diagnosis of these cancers, but this is not the case. So even after pregnancy, breast cancer and cervical cancer remain in the post-pregnancy period, remain less frequent than expected. So the conclusion is that it appears that pregnancy protects, in brackets, from some cancers, breast and cervical, while in melanoma it does not have practically any influence in the incidence. So the incidence remains unaffected, and that's why melanoma becomes number one, because the others are very rare. Now, three scenarios that through these scenarios we will see some of the questions that already are in the chat. 35-year-old lady, melanoma 2.5. What do we tell her to do? First option, wide excision and sentinel lymph node biopsy cannot be performed during pregnancy. Second option, wide excision and sentinel lymph node biopsy should be immediately performed now during pregnancy. Third option, wide excision, yes, sentinel lymph biopsy, not. So sentinel lymph biopsy after delivery. Fourth option, wide excision, yes, sentinel lymph node biopsy, no, and therefore it doesn't make sense to make the sentinel lymph node biopsy later. So interesting in my view, options. Do you have a clear answer?
Yes.
Which is?
B.
So you mean, first, let's say that concerning wide excision, there is nothing to discuss. There is no problem at all with excision and also with a wide excision. That's clear cut. There are no second thoughts. A discussion is needed concerning only sentinel lymph node biopsy, because the blue dyes that are used in the sentinel lymph node biopsy have been reported to be teratogenic. Therefore, here there is an issue, but there are ways to perform the sentinel lymph node biopsy without using the blue dyes, and this is safe, so there is no problem.
And actually, as far as I know, the blue dye is very rarely used anymore. So we just use the lymphoscintigraphy, and that's it, basically.
Exactly. So in my view, from the previous answer, I would also select B as you. The second answer would be D. So if you decide not to do it, then you don't do it. You do only the wide excision, and it doesn't make sense to do it afterwards. No sense at all. What about imaging? Because in a melanoma like this, out of pregnancy, we also do some imaging techniques. Here it's easy to say, ultrasound, no problem, MRI, no problem, CT, of course not, okay? Especially in the first trimester. So we just change CT with MRI and everything can be done. Now, scenario number 2, 32-year-old lady, melanoma 4 millimeter, third month of pregnancy. What do we tell her? We tell her that she should do a therapeutic abortion because of the risk of transmission of melanoma to the fetus, or we tell her the opposite, that there is no risk. So there is no reason to discuss or think about abortion. That's also important in my view. And here there is a clear-cut answer. I don't know if you want to give it.
Yeah. Yeah.
Obviously, there is no problem at all. This is a discussion that we don't need to do. Therefore, let's move to the last, which is also a question in the chat. 37-year-old lady with a melanoma 3.5 with ulceration. We see her 6 months after the diagnosis, and she's asking if she can be pregnant. What do we advise her? We advise her that she rather should not, within 2 years. We advise her that she rather should not for 5 years, or the last. And I know that this is not so easy.
Not so easy. Not so easy.
C.
But C is the most reasonable.
C.
Yeah. So the point is that, of course, in a melanoma with bad prognostic characteristics, and this is a melanoma with bad prognostic characteristics, 3.5 millimeters with ulceration, theoretically, it could be good if we can wait a couple of years. But then, if the lady is 37, then suggesting to wait a couple of years is not so simple.
Yes, exactly.
Mhm.
So she has to know that there is no risk for the kid, for the pregnancy per se. But if she recurs, it's of course complicated, and therefore things can be quite challenging.
It's a complicated. It will be a complicated scenario because you cannot apply your treatments that you would apply otherwise. Okay, so that was it.
Yeah. So you replied to many of the questions. Can a woman fall pregnant after having had a melanoma removed? If yes, how long must she wait? Again, if it's a very high risk melanoma, the problem is only in the terrible case in which she is recurring during pregnancy, therefore minimizing the possibility to treat her in the proper way.
Do we have any data for melanoma recurrence during pregnancy?
I'm not sure, but I don't think there are clear-cut data about it.
I don't know. That's why I'm asking. I have no idea. I'm not aware of such data.
Yeah.
Emilius,
I
do you
don't
know?
recall any paper working on this particular.
I don't think that there is the answer to your question based on data, because it would be very difficult to have this kind of data. So relapses of melanoma during pregnancy as compared to relapses in the same age, same characteristics of melanomas out of pregnancy. I don't think that this answer exists.
Yeah. Do you think that pregnancy increased the risk of developing a new melanoma?
Well, based on what we just saw in the data, no. It appears that the appearance of melanoma is not changing during pregnancy. The possibilities are the same with when you are out of pregnancy, of course, in the same age group, obviously. So no is the answer to this.
Yeah. Prognosis may be worse, but do melanoma actually occur more frequently in pregnancy, or are they just picked up more often? Yes, do not actually occur more frequently in pregnancy, as Emilio was showing. So it's a false figure based on the fact that there are actually a couple of cancers which are decreasing in numbers, meaning the breast cancer and the cervical cancer. Francesca, melanoma in young woman can get pregnant, or we wait 5 years? Okay, we replied already. Zoe saying, considering what Jeppy presented about the poorer prognosis, then melanoma in pregnancy should be treated in a more urgent, intensive way?
Correct.
Yes.
Correct. Exactly. So the point is that the threshold should be lower in pregnancy, not higher.
Yes.
To excise, the threshold to excise a lesion should be lower.
Yeah. This is also a very important question. Can hormone replacement therapy be the cause of melanoma growth or the appearance of melanoma or new melanomas?
That's a nice question, and we have some very recent data on it. Again, a meta-analysis by Kostas, which showed that, again, surprisingly, because we expected the opposite, it showed that there is an association between hormone replacement therapy and melanoma, statistically significant.
Prognosis.
I already
prognosis,
have.
but not
I'm going to show
melanoma
you.
incidence.
Incidence.
So more melanomas are developing in those women treated with hormones.
Exactly, and this was not related to the kind of hormone replacement therapy. So both in the monotherapy and in the combination therapy, there was a statistically significant difference. Is this data from Australia registry? No, the data I showed you was from a Scandinavian registry. I think Denmark.
Okay. Yeah. So
I have a question.
Yes.
For example, think about a patient in the second trimester and diagnosed with a 3.5 millimeter melanoma, and we can't do sentinel lymph node biopsy, but the melanoma is on the leg, and inguinal lymph node ultrasonography showed that there is atypical lymph nodes. And would you recommend total lymph node dissection to the patient?
So you mean general anesthesia? This is the question.
That's the question. So if you can do it by, the question is the anesthesia. Of course.
I think that if in the scenario as Nisa described it, the next step would be to evaluate with a free needle aspiration the suspicious lymph node. That would be the next step. Then if it's positive, then it becomes complicated.
So if you can do it with if it's inguinal, you can still do the back anesthesia, regional anesthesia.
Anesthesia is possible. It's not contraindicated.
Yes, it's no problem. It's no problem.
No, but the problem is here.
It's a problem here. Clear.
Are there studies that melanoma in pregnancy respects the ratio de novo versus nevus associated?
I don't know.
I don't think so.
I don't know. No.
What should be the follow-up intervals in the postpartum period after melanoma has been removed during pregnancy? Same stuff as usual. Yeah. And last one is suggest the patient that had the recent melanoma to wait for another pregnancy. Depends only on the age of the patient. Well, it depends from various factors, of course. If we can wait a couple of years, then we are more on the safe side. If the age of the patient is already at the limit for a healthy pregnancy, and then we should discuss case by case.
Andrea did a wonderful comment, which says that since hormones in pregnancy are not related to increased incidence, but replacement therapy is, then probably the extended length of exposure to hormones may be a risk factor. Exactly. This is a very reasonable hypothesis. In fact, in the meta-analysis in the paper that I told you, what you say, Andrea, is written there as an hypothesis, of course, which reasonably comes with this data. Very good. Fully agree.
Yeah.
Beautiful.
Should we routinely screen pregnant women for melanoma? That's another question.
Do we do general population screening?
No.
As we saw, the incidence is the same as in non-pregnant women. So
exactly.
If you are within a program, within a country like the northern of Germany that does regular screening, okay. But if you don't do it routinely, then you don't either.
Yeah.
Yeah, let's repeat it once again so that we avoid any misinterpretations. Obviously, melanoma in the age group of pregnant women is not frequent. That's clear. Okay, melanoma is frequent after this age, not in the age of 25 to 35. Okay, and this remains the case also in pregnant women. So it's not definitely a high risk population to develop melanoma. So there is no need to screen them.
Yeah.
Particularly.
Wonderful, wonderful, wonderful. Okay, okay. Guys, so what do you think about going to the next step of the episode?
But it's so interesting. Like this is a topic that came up from the discussion last episode, right? And these are also flaming topics that are unexplored, that need discussion. You see all the questions, they're all on point. Like
Sure.
Everyday questions. What do we do now?
Yeah,
I love it. Let's move to the next one.
Absolutely.
Clear,
Absolutely.
clear.
Is there any question that we didn't take?
I don't think so. I think it's
One just came right now. If Spitz nevus in pregnancy could be more concerning. No, it's the same as same age group.
yes.
There is another question saying that the immunosuppression in pregnancy is transient. So, which is the reason for increased melanoma? There is no increased melanoma. There is no increased incidence of melanoma in pregnancy. There is stable. Same numbers as outside pregnancy in this age group. The difference is in the prognosis, not in the incidence.
Yeah, Emilius, repeat this like once again to be completely clear. No increased incidence, but worse prognosis may, we hypothesize due to immunosuppression, but no increased incidence.
Mm-hmm. What is the role of gynecologists? Are they able to recognize melanoma? Okay, good point. From a practical point of view, relevant point. Of course, a gynecologist is not at the same level with a dermatologist, obviously, to diagnose melanoma, and it wouldn't be easy. What makes sense, in my view, is just to try to spread the voice to gynecologists that melanoma in pregnancy exists, and melanoma should be diagnosed as early as possible. So they should not ignore worrisome things on the skin of their patients. Are biologically aggressive melanoma subtypes more frequent in pregnancy? No, in the meta-analysis there was not statistically significant difference in the subtype, but there was in the prognosis. Okay.
Wonderful.
Fantastic.
Excellent.
Fantastico. What about the next, Sebi?
Before this, Jeppy, maybe you have to show something.
Maybe.
You have to show something.
Every time the same discussion. Okay, then I show something.
Yes.
I show something, which is this wonderful equipment, the new toy, the new handheld dermatoscope from Dermlight. This is the Dermlight 5, but today I don't want to speak about the dermatoscope itself, which is obviously wonderful, but about the other equipment that you see in the photograph, this small adapter, because this is a very important issue nowadays. We all take photographs and we worry if the new smartphone that we will have will fit with the old adapter, and then how can I find the new adapter for the new iPhone, and so on and so on and so on. So Dermlight provides this universal adapter that, as you can see, can be adjusted to any smartphone, and of course with this magnet to the dermatoscope, and therefore you don't have to worry anymore about when you change your smartphone.
Very good.
Okay, so now we can go to
Yes.
case.
Yes.
But I don't know, Nisa, today you have prepared cases from
Yeah,
Facebook
I have.
or not from Facebook?
Facebook combination mixture.
Combination, okay. Wonderful.
Okay. And can you see the screen?
Yes.
Yes.
Yeah, okay. The patient is a 23-year-old female and she's pregnant, 14 weeks. This pigmented lesion occurred 6 to 8 weeks ago. She was so concerned and came to me to show this lesion. And here is the close-up.
Mhm.
Okay, everyone see. And what's your diagnosis?
Okay.
Okay.
Well, for an hemorrhage, it could be very,
Very optimistic.
very unusual. Yeah. Let's see.
Yeah.
Okay,
Let's see.
nevus for
Nevus.
60%. Melanoma for 30%.
Nevus,
Mm.
60%.
60%. And melanoma 30. Okay, let's go to the case again. And what do you think, dear friends? Does it look like a nevus
Remind
Well,
me
It's a
the
little bit,
to you?
it's a little bit irregular,
Mhm.
the band, but it's
Do we expect to see these changes in a nevus?
Well, the point is that the band is definitely regular, but it's quite thin.
it's small. Yeah, exactly.
It's small. So in my view, the size in this particular context is really the most important criterion. So of course, we cannot know if this is a very initial melanoma or a nevus. So either we make a biopsy or we make a monitoring. In my view, both options are definitely correct.
Yeah. Yeah. From my point of view, when I look at the lesion, really, I have never seen a white structureless bluish color. And here you can see some thin brown lines and some brown to gray dots here. So it was so unusual. I have never seen a nevus like that. I wasn't so confident with the lesion. And since we know that hormonal and immune status and increased lymphangiogenesis in pregnancy is associated with increased metastasis. So, of course, if this is a melanoma, it's still very early, but who knows? This appeared 8 weeks ago and rapidly grow and changing as the anamnesis. I would like to make a biopsy rather to follow up.
Mhm.
And histopathology showed that this is a melanoma in situ.
Okay.
And we confirmed the diagnosis in another center who was very experienced with nail matrix lesions. And 2 centers said that this is a melanoma in situ.
Mhm. No, it makes sense. I mean, it fits with the morphology that we see. It's an irregular band, a small irregular band, but so it's okay. It's reasonable that it could be a melanoma. But also, in cases like this, as we discussed in another episode, a follow-up is not forbidden. Let's say it's an acceptable. It's an acceptable.
Yes, especially because this is an area in which to obtain a biopsy is not so easy as is on the regular skin and so on. So in order to have a better argument to make a biopsy, a follow-up could be an option. Also because melanoma in situ of this area is growing very slowly. So the risk of melanoma in situ is becoming invasive and rapidly growing is very, very low. Therefore,
but the patient, this lesion developed very soon, almost 8 weeks ago.
Yes, but this is
and
what
there's
the patient
some
is
grayish
saying.
color.
By the way, there is a question by Melanie, which is very reasonable, saying that, but how is it possible that the lesion is only 8 weeks and it's already in the peripheral,
exactly,
distal part of the nail plate? Of course, you are right, Melanie. This 8 weeks was just what probably the patient said that she first
maybe
noticed.
more.
She first noticed the presence of this band 8 weeks ago, but obviously it's not only 8 weeks there. Could you please give more details? Andrea asks, could you please give more details on how a nevus would look? What makes this irregular for you? There are not width changes. Yes, it's not a wide band, but say, Nisa, say. Say.
Yeah, it's not a wide band. It's a very narrow band, but we have here a grayish color and white structureless area. This part, from my point of view, looks highly suspicious. And the other part where there's brown color is dominant. The bands are so thin, but according to the grayish and whitish side, that part was suspicious for me.
Yeah.
So to the
It's
question,
irregular, it's irregular because there are two colors.
Exactly.
Dark brown and
Mhm.
light brown.
yeah. So to the
The
question,
upper part-
how a nevus should look like, the answer is that we would like to see an homogeneous band, so one color only for a nevus. While here there are at least two different.
By the way, guys, how for me it's super nice that Nisa is using always analytic terminology and we're always using metaphoric. So it's like we're describing the same thing in different terms, but you know, it's always the same conclusion.
What metaphoric did we say now?
We didn't, but like she was describing like white clouds. This thing is it's like very
Yeah.
interesting.
It's like speaking English American or English English. It's the same.
Exactly.
Okay.
Okay.
Can I go to the second case?
Yes.
Sure.
This is the case.
Wow.
Okay.
This is so interesting. The patient is a young patient. She's 22 years old again, like the previous one. And she said that this pigmentation developed during pregnancy. Actually, the diagnosis is clear here
Yes.
because it's a clinical diagnosis. So this is a nevus of Ota.
Ota.
Thermal
Yeah,
melanocytosis.
Ocular dermal melanosis, which involves the trigeminal nerve and maxillary and ophthalmic branches. I just would like to share with you, is this possible during pregnancy or not?
While people are voting for this, there is a question concerning the previous case that I think we should answer. The question is, if it's difficult to get a biopsy, could you do a punch biopsy from the nail bed? And the answer is definitely not. In any scenario, there is no sense to make biopsy from the nail bed. If we decide to do biopsy, it should be only from the nail matrix.
Exactly, because the pathology is within the matrix. The cells are within in the matrix. The band we see under the nail bed, under the nail plate, is just melanin. So you don't find cells under the nail plate.
So what was the answer? What did 50-50?
Yeah. The answer is it's possible because nevus of Ota can develop generally. It's a congenital type, but during puberty and during pregnancy, it can happen. So this is a nevus of Ota. There is no malignity here.
Yeah.
Okay.
It could be possible as blue nevi can develop acquired. Also, Ota nevus can develop in an acquired manner. Yeah. Good.
Yeah.
Good to know. But you know that I also learned something new this weekend, is that the world of mosaicisms is very broad, and Ota nevi are belonging to the family of mosaicisms. You know, because it's a post zygotic mutation. Yeah, and this create a mosaic of cells which are different in terms of genetics.
Tatiana Nikolova posed a nice question, whether nevus of Ota is pre-existing and just more pigmented with pregnancy. No, it's appearance. So as Debbie was saying, it's precisely. It can present.
Yeah. Present. And the malignant transformation is extremely rare in nevus of Ota.
Yeah.
What is the treatment? If the question is about this case, what is treatment for nevus of Ota? There is no treatment for nevus of Ota.
Yes.
Laser. Maybe post-dial laser.
Yeah, laser.
Mm-hmm. Yeah. And here are some information about nevus of Ota. And I would like to show you a little presentation. that we performed maybe 5 or 6 years ago, but we still didn't publish this report. We analyzed almost 200 nevi on different localizations of 42 pregnant women, and we didn't see any melanoma during this period. It just grow, and the growth rate was statistically significant in all sides, belly, back, arm, leg, but they returned to normal size, almost normal size after delivery. And we follow up the patients 6 months later after birth, and all returned to their previous sizes. For example, have a look at the changes, baseline, week 35, and postpartum periods, the clots disappear and almost the same size. It grows, but regressed again. This is postpartum first year. And you can see the changes again. For example, for this one, it's growing, but later, after delivery, for 6 months later, it's as the same size with the baseline. And here you can see again the growing news. They're all regressing again.
Yeah.
And this is the same.
Wow, that's quite ugly, I have to say.
I was like, what is that?
This is a blue nevus. It was there
Blue.
since birth. Yeah,
Blue.
Okay.
it was on the leg. Yeah, but the color is so bad because it's from our old computer Molmex. That's why it looks
This is
scary.
a Molmax
Yeah,
picture. Yeah, this is a Molmax picture.
yeah, yeah. Due to the technique. Yeah.
Fantastic.
Okay.
Very
That's
good.
it.
Very
Wonderful.
good.
Thank you.
Lisa.
Wonderful.
Fantastic.
Beautiful.
What's next?
Thank you.
What's next, Sebastiano? Sebi, Sebi. Sebi, Sebi. Sebi, Sebi.
Debbie went to have a drink.
Yes.
Too early for us, unfortunately.
Yeah.
Yes, cases from you, Dermoscopy. But you know something, Emilio. I know. I learned also something else during this weekend.
What?
You are
Tell me.
struggling. You are struggling to get a name for a disease. Your name for a disease, Lalla's disease,
Not for a disease.
or a sign, or a sign,
yes.
Lalla's sign, and so on. But you
Yes.
know what is the field? In our field, what is the best chance to get your name on a disease?
Trichoscopy?
I don't know.
No, when you are dealing with rare genetic diseases.
Yes.
Yeah.
And these syndromes, so you discover a new syndromic combination of symptoms, and you give your name to the disease.
Thank you, Jeffrey.
Eh?
Are you going to help me?
Yes, of course. Yeah. Bene.
Okay.
Kostas.
So, as you would imagine, and as life would have it, I think in the very similar way with Emilio's. So I had prepared some cases that are pretty similar with Emilio's in terms of management of lesions on pregnant women. So let's see 5 cases and ask people what would do. 23-year-old female, pregnant at 20 weeks, presents with this new and rapidly enlarging lesion. What's the management? Sebi, would you monitor the lesion? Would you excise the lesion after delivery? Would you excise the lesion immediately? Or would you reassure the patient?
Monitor 50%, excise 50%.
Yeah.
Okay. Zepi, what do we do?
I don't care too much about the history. Morphologically, this is not really disturbing me too much, so I would monitor.
Yeah, I think this is a acral spitz nevus.
Yeah.
Would monitor.
Acral spitz.
Yes.
Acral
Acral spitz. Yes.
Nisa, do you
Acral
agree?
spitz.
Because Nisa is the expert of acral spitz.
Nisa?
I don't know. Doesn't look like, but possible.
Yeah.
Okay,
It's a bit
So
out
what
of
did you
focus.
do?
I
What did
cannot
you do?
see the
Excise?
details.
Okay.
what they do, I monitored.
Okay.
Oyuncu.
36-year-old woman, pregnant at 20 weeks again, presents with this lesion.
Okay.
Management,
Yes, let's see.
would you monitor? Would you excise after delivery? 20 weeks, so it has still 5 months to go. Excise the lesion immediately or reassure the patient?
Okay.
Reassure the patient that we will excise the lesion immediately and everything will be fine.
Excellent.
Because it will be a melanoma in situ. Yeah.
Exactly. It
Yeah.
will be melanoma inside.
Yeah.
Thirty
Melanoma. So this was confirmed to be melanoma in situ?
melanoma inside, yeah.
Okay.
32-year-old woman, pregnant at 35 weeks, presents with this enlarging lesion. This is the clinical, and this is the dermoscopy. Management.
Vediamo.
We've talked about this.
Let's see.
Let's have a look.
No, why?
Monitor.
Reassure the patient. I
Reassure the
would vote.
patient. Reassure the patient. Me too. Well, okay. Monitor. We
Yes,
don't.
yes.
We
don't.
never say no to monitoring. Yeah.
Yes, of course.
Yeah.
But the reason I put this lesion is because we discussed about it. Symmetrical globules and dots are all around the lesion without concerning dermoscopic features. We can reassure the patient and see them back whenever we want.
Yeah. So to sum up from these 3 cases that you showed, I would say that in the second lesion, we didn't like the lesion, so we wanted to excise it, which would be the same story as outside pregnancy. No influence
Exactly.
of the pregnancy on the decision. In the other 2 scenarios, the lesions were more or less okay. So that's why.
Yeah.
Exactly. But now I have a little bit more complex scenarios.
Yes.
42-year-old woman with history of 3 miscarriages, pregnant at 8 weeks, beginning of pregnancy, presents with this lesion. Management.
Okay.
Whatever.
Yeah.
Cryotherapy.
Cryo, yes.
Yeah, looks like a superficial one.
Yes.
It is a superficial, whatever. Like you can even monitor.
You can even monitor. Yes.
You can even monitor. I agree. I absolutely agree.
Yes.
And this is the next scenario. 42-year-old woman with history of 3 miscarriages, pregnant at 8 weeks. Repeat scenario. Presents with this lesion.
Same patient.
No.
It's another
The
one.
scenario. I'm giving a scenario.
Okay.
A scenario. Patient is very worried. She wants to have a baby, very bad, and she thinks that local anesthesia may cause a problem to her pregnancy. What do you say? What do you do? Excellent. Excellent.
Yeah.
Perfect.
Perfect. Perfect. So I think this is the message that I want to get through. Is like it doesn't change management, no matter the worry of the parent, no matter of whatever. We do what we need to do with the patient.
Yeah.
And a case that came in our email this week regarding a pregnant woman. So we had to show it from Tina Thompson from Estonia, 37-year-old woman, flat lesion on the abdomen. It appeared during her 3rd pregnancy in 2021, and it has not changed since. This is the clinical.
Oh,
Yeah.
Yeah.
So cute.
leave it there forever.
Yeah.
And we do love dermoscopy.
Bravo.
Fantastic. By the way,
Wow.
since
Bravo.
you showed the case, let's just remind that, of course, we have many cases that we didn't show. And that's why very soon we will have another episode with cases and we will show them there. But we just did an exception for this one because it was related to the topic
Yeah.
of the day. Yeah.
Exactly. And 3 cases from the dermoscopy app uploaded this week. Location on the upper limb, age 62, male, a small red papule on his left arm 3 months ago that started growing rapidly in the last 2 months. This is the clinical, and this is the dermoscopy.
Lymphoma.
Lymphoma.
And
Lymphoma.
what is the diagnosis?
Lymphoma.
Rather.
Let's see what people will vote.
And now we influence.
Now we did
Now we'll have 100%.
yeah,
Yeah, 87% other. Yes, of course.
of course.
However, it's interesting that in the group, that wasn't the percentage if you weren't so influential.
Yes.
So that's an interesting
See,
experiment.
that's interesting. That's interesting.
That's an interesting experiment because usually they coincide, you know? If you didn't speak
Yes.
before,
Yeah.
we should have seen the results. But this also already shows us, like, the expert opinion, it can be very guiding.
Yeah. No, but
Of course, it would be interesting if the expert suggests the wrong. If still the influence is the same.
No. It will be.
Our audience is already an expert. They're all great. They don't need us.
Exactly.
But still more than the relative majority voted for other. So it looks like
Yes.
most of them thought about it.
Indeed. Second case coming from, what is this country?
Austria.
Austria. It's a little bit dark, the red. I think it's, anyhow, located on the back.
Also, Latvia has a very similar.
Yes, because I'm not sure this is Austria.
Yeah, it could be Latvia. Yes, you're right. Good.
Okay, located on the back, 32 years old male, on routine skin check, presents with this lesion that looks like this clinically, and this is the dermoscopy. Hey, Sebi, wait. This is the dermoscopy. Now you can put the polo up. What do you think? What's your diagnosis?
What's wrong with this lesion?
What's wrong with this lesion?
Pretty benign.
It's fine. Huh?
It's one of these inflamed nevi.
Yes.
45% nevus, 35 melanoma.
I go with the 45.
Yeah.
You go with the 45.
Me as well.
Of course, it depends from the scenario, overall scenario
Yes,
of this patient.
Okay, and the vast majority voted for nevus here. I personally voted for melanoma because of the negative network.
Negative network, yeah.
So I personally think it's a spitz, but I would cut out to exclude melanoma.
You voted for melanoma because you were in a bad moment at the moment.
Bad mood.
Something happened and you were in a bad mood.
Bad mood. And
Correct.
final case.
Yes.
15-year-old female on the upper limb appeared 3 months ago. This is the clinical, and this is the dermoscopy. Similar.
This is a very specific location for a specific lesion.
Yes.
And similar scenario. Put it up, Sebi. What's your diagnosis?
Yes, but here, unfortunately, the precise answer cannot be given, but it's okay.
It's okay.
Yeah. Yes, most nevi, but this is very specific for spitz nevus. Also, the age is according. So, yeah.
Debbie, what would you do with this patient? Excise, monitor, never see her again.
Age, you said?
15.
15.
Oh, I would monitor.
Emilios?
Yes. Of course, the official answer is that we have to excise it because it's more than 12 years old. And this is the official answer. But in reality, still in this age group, we are quite relaxed. That's the truth. So very frequently, even in 15, 16, 17, we are still relaxed and we...
Nisa, what would you do?
Probably I will exercise it. The reason is I know that it will grow very fast, and I'm sure that this is 100% spitz nevus, but maybe 6 months later it will look more worrisome and the surgical scar will be more horrible. So better to exercise it when it is small.
So yeah, for me, this is like a 2-option scenario. I either tell the parents that this is a spitz nevus, it will grow. If you don't like it, I will take it out now, but it will be a spitz nevus, or go home, I will never see you again.
You know what? I can predict if we are good after many years in our health. I can predict us in our 80s discussing again. What would you do?
Exactly the same thing.
No, it's better if you do like this. Yeah, having changed opinion for 20th time.
Yeah. Wonderful. Okay, by the way, Chin is saying something very important. Lala's sign is the eczematous halo of a clear cell acanthoma.
Thank you, Chin. Thank you so much. That's true. Of course, somebody needs to publish it as a
As Lala sign.
yes,
Okay,
and
I
I
will do
cannot
it.
be the one. I cannot be the one. Yeah.
Emilia, I would do it.
Yeah.
Let's gather all clear cell acanthomas and I will publish it. Nisa, are you first co-author as well? We'll call it the Lala sign.
Sorry.
And then it's done.
Done.
Very
Fantastic.
good.
Jeppy,
Okay.
show us something. Show us.
What?
You-
Yes.
What?
Yes, of course. I have to show you something very briefly. Something again in the context of the new Triasorb, which is this new sunscreen molecule invented by Aven. They tested the property of Triasorb in preventing oxidation by blue light in a in vitro experiment in which they were exposing to blue light a piece of skin which was and they were looking at the oxidation of a specific molecule, which is the hydroxydeoxyguanosine. There is a molecule which is easily oxidated by blue light. And as you can see here in the first in the first picture on the top left, you see that there is no blue light, so it's a regular situation. Then the skin exposed to blue light, you see much more redness, so it means that there is oxidation of this molecule. But then look at when you add Triasorb and exposed to blue light, there is a complete absence of oxidation of this molecule. So again, Triasorb is a good a new sunscreen, of course, protecting against UV light, but also against the blue light.
Fantastic.
Okay.
Wonderful.
Nice.
So now, at the very last moments of the episode, we have first to see today's Penelope's gift, which is, as always, is wonderful. So there we go. 6 lesions, my friends, for you. The clinical aspects.
Mm-hmm.
Okay. Do you want dermoscopy?
Yes,
Yes.
please.
A lot?
Yes, please.
Okay, there you go. So let's go. One,
Wart,
2,
blue nevus,
3,
It's nevus.
dermal nevus,
Thermal nevus.
4,
seborrheic keratosis,
5,
Seborrheic.
6,
lymphoma, 5 lymphoma,
6.
6, I don't know.
You did well.
5 can be also
Keratoconoma?
leishmaniasis.
You did well. Lymphoma was 5. Seborrheic keratosis was 4. You missed a BCC, but it's Okay. Blue nevus with a spitzoid pattern. Nice.
No.
I think one of you said blue, the other one said spitz.
Yes.
And seborrheic keratosis and dermato fibroma number 6. A special gift. There is a special gift.
Thank you so much, Penelope.
Because you said that in a dermatofibroma, the polarizing structures do not cover the entire surface. And here is your answer.
Yes. Like for everything I say, there is an answer. I'm always proven wrong. Thank you so much, Penelope. I love
And
this.
for me also special gift, since I like very much, it's true that I like very much these seborrheic keratosis with prominent white shiny streaks, and these are some wonderful examples of seborrheic keratosis with white shiny lines. Send us your case at this email address, because soon we will have another episode with your wonderful cases. And now it's time for
Kahoot.
Okay, there we go. There we go for our Kahoot. Let's see now how things will move.
Great.
You
Last
think so?
mode. Ready to join under the number of
Okay, fantastic.
1821102.
By the way, Zeppi, we had a Kahoot here at the IDS session at the AAD, and Lala's won.
Lalas.
Which Lalas?
This Lalas or another Lalas?
Yes, there were people playing. At some point in the leaderboard, there was Lalas, Emilios, and Lala's hair in the three first positions.
Wonderful.
Okay, so as usually, it appears that many people cannot connect, but it's not true. You will be all connected. Don't worry at all about it. So we will start in a few seconds.
It works.
It somehow works. Well, but not good, because in fact there are 150 or 200 people connected.
Yeah.
So let's start and everything will work. Let's be optimistic, guys. Episode 11 of the season 2 of Dermoscopy Happy Hour. This is our Kahoot, starting with the first lesion, which is this one.
Okay.
On the forehead, non-pigmented, nodular somehow. And this is dermoscopy.
Yeah.
Okay. And let's see the options. So do you think that this is a basal cell carcinoma, lymphoma, Merkel cell carcinoma, or cylindroma?
Cylindroma, part of the Lalas-Spiegler syndrome.
Exactly. Wow, it's fantastic. So I mean, it's so nice that we reached a point that we can recognize lymphoma with this. With this accuracy. This is quite recent, I have to say. So a couple of years ago, this would not be the case. But now we know the pattern and we can recall it. The orange color, the lymphocytic infiltration, and the vessels that typify lymphoma. Very good. Albert. Is Albert the usual winner? No. Not Alberto. No, it's not Alberto.
No.
No. Okay. Good.
No, it's I understand.
Number 2, somehow similar, scalp again, nodule, non-pigmented. Yes. This is what you get in dermoscopy. And the options are precisely the same: basal cell carcinoma, lymphoma, Merkel cell carcinoma, or cylindroma.
Capito?
Capisci?
Capito?
Yes, ho capito.
Capito.
And
it's definitely the Lalas Spiegler syndrome.
Yes, cylindroma. And now I want to show you something sweet. Look,
What?
Wait a moment. First, the classification. Albert is still. Oh, but 2 points only from MA.
And like 14 from Cherry. It's nothing.
Yes. So take a look. This was my first paper ever. The very first.
What's here?
The very first. The first.
Favoloso.
Eh?
Dermoscopy of solitary cylindroma.
Yes.
Mm.
Nice. Okay. Which brings us to question number 3. With no points, the main red wine in Napa Valley is Cabernet Sauvignon, Syrah, Merlot, or Pinot Noir.
But this is a very difficult
This
one.
time I also know
This
it,
is very
Emilios.
easy. This is very easy.
No, it's difficult. Let me tell you.
Come on.
It's easy for me.
These are the basics.
Emilia, it's not that easy.
Come
I
on.
know the answer, but
You see how difficult it is? You see how difficult it is? See?
Cabernet Sauvignon, guys. Napa Valley Cabernet. Cabernet and Chardonnay in the white wines. This is the main. Main.
Actually, Napa Valley has one of the best Chardonnays, some of the best Chardonnays I've ever drank.
I agree.
Good.
And number 3, again, non-pigmented nodule. This is dermoscopy.
Okay.
And
Clean
here are the options. Do you think that this is an angioma or pyogenic granuloma? Do you think that this is a Kaposi? Do you think that this is a melanoma or a Merkel cell carcinoma?
I think clinical
Everything
was
possible
more.
here.
Clinical was more informative.
Yes.
Really tough, eh?
I have a slight preferential, but yes, Kaposi. Yeah.
Kaposi. This was a Kaposi. Okay.
Biopsioma.
Eh?
Biopsioma.
Yes. Which brings dermatology girl in the first place.
Oh,
Dermatology girl is it was for 2 consecutive times in position number 2. Yeah, fantastic. Now, be careful because it's a puzzle. So, from most to less frequent site of melanoma development. So you have to classify with your smartphone, move up and down from the most frequent to the less frequent. Among these 4.
Nice.
It's feasible. Come on, it's feasible.
Feasible.
Absolutely feasible. Yes, absolutely feasible. Come on.
Like from daily practice, you can get the numbers.
Yes, of course. Yes, definitely.
How often do you see mucosal melanoma?
Never.
Almost. I don't think. Well, I've seen 2.
Oh,
3.
Yeah, exactly. So of course the correct classification is trunk first, face second, palms and soles third, and mucosa fourth. And let's see what happened. Dermatologist girl is still there. Fantastic.
Very close is Ron's.
Very
Bias.
close.
I support Dermata girl.
Yes. We know.
This time.
So
No
We've
points.
got it.
Look, be careful. Who said this?
If in doubt, carry it out.
okay, yes, guys, let's do it.
It was not Socrates. It was not Platon. It was not Aristoteles, but the great philosopher of the modern era.
Yes. Okay, who said if it's pink, stop and think?
I was expecting this moment for 10 episodes.
Hey, come on. This is, yeah.
Beautiful.
Last question. Last question is again somehow peculiar. This is the clinical image. This is dermoscopy.
Okay.
Yeah.
And now you know what I'm going to ask. I know that you know.
Yeah.
I know that you know.
Yeah.
Breslow.
Hey.
Breslow.
Hey.
Okay, we need to give
Clearly
our...
here, the real question is if somebody believes that this is a melanoma only or a dermal nevus with a very
Associated.
flat.
Yeah,
Yeah.
nevus associated. Yeah.
Yeah. So the answer is
Jeppy, what's your prediction?
Well, I would say that this is a thick lesion. It's not a thin melanoma. So I would say, so the correct is 0.8. Yeah.
the correct is 0.8 because this is a dermal nevus, and the melanoma was flat, the flat component, so it was 0.8. And of course, one more example of a dermal nevus, on which, or at the periphery of which, a melanoma developed. Fantastic. Are we ready for the podium? Nisa, you are stressed?
Yeah.
Let's
I'm
see.
so stressed.
Let's see.
Let's see.
Number three is
Dermide.
Dermide.
Bravo, Dermide.
Amen.
Amen was there from the beginning. And
Ronge.
Rongi. Wow.
Congratulations.
Hai capito.
All of you.
Amazing.
Rongi.
By the way, Jeppy,
Yes.
I did the AAD dermoscopy ball. You remember that?
Yeah.
You know, and As's son was competing.
Okay.
Nisa said she was biased. I was so biased, but at the same time, it's like I couldn't do anything. So he did perfectly. He won the competition. But he was doing so well. At some point, I was like, high five. He was like, dude, you cannot do that. Like the other watching.
So, but do we have Rongi? Do we have Rongi to say to congratulate him or her? I don't know if we do. Yes, we do.
Okay, Rongi.
Roniel from Peru. Wow,
Peru. I see. Wow.
Hi, Roniel.
From Lima? From where?
Yeah, we don't know. I don't know.
Actually.
Roniel, are you with us? Yes.
Hi.
Yes,
Roniel.
Hey, Roniel.
Congratulations.
You're muted, Roniel.
We don't hear you, but we can see you. Congratulations, Roniel.
Very good job. Bravissimo.
Fantastic. We don't hear you, unfortunately, so that we don't know where you live, in Lima or in another city, but anyhow, many congrats to you. Amazing. Lima. Yeah.
She's from Lima.
Lima. Nice. Thank you all, my friends. So be careful in New Orleans. Don't drink too much. Don't eat too much. Don't have too much fun without me.
It's impossible to have fun without you.
Not have fun without you.
Yeah. Okay. This is the correct question. This is the correct answer. Okay. So I see you next week.
Yes.
See you
Auguri, JP.
Love you all.
Bye to everybody.
Bye-bye.
Bye-bye.
Ciao.
Thank you all.
Bye. Thank you so much.
Thank you so much. Bye-bye. you.